Good day everyone! I am Mary Joy Iragudo, a second-year Bachelor of Elementary Education student, and I am back with a new topic to discuss, which is all about learners with chronic diseases, which are asthma and diabetes. So without further ado, let us now start our discussion. Let us first discuss the disease asthma. A chronic condition is a human health condition or disease that is persistent or otherwise long-lasting in its effects, or a disease that comes with time. The term chronic is often applied when the course of the disease lasts more than 3 months. Asthma is a lung disease that makes it hard to breathe. Airways get irritated and swollen and may fill with mucus. Muscles around the airways may tighten, causing narrowing. Asthma is one of the main reasons that students miss school. There is no cure for asthma, but it can be managed so that kids and teens can live otherwise normal and healthy lives. When asthma symptoms happen, or called asthma flare-ups, students may need to make urgent visits to doctors' offices or the emergency room. During a flare-up, someone might have asthma flare-ups includes wheezing, coughing, tightness of the chest, and the shortness of breath. Bullies often target students who seem different, so having a health condition like asthma can put kids and teens at higher risk of being bullied. Asthma is a common chronic disease in children. Uncontrolled asthma is a significant contributor to school absenteeism, emergency room visits, and hospitalization, all of which can lead to low school performance, financial burdens, and emotional problems for children and their parents. Asthma in children restricts the activities of school-aged children, such as participating in before and after school activity and extracurricular activities such as sports. Uncontrolled asthma has the potential to impact a student's self-confidence and social interactions. This article reviews the physical, emotional, and social burden of asthma on school-aged children, parents, as well as recounting school asthma intervention programs. Students with asthma may need to take oral or inhaled medicine, usually in the school nurse office, feel jittery, anxious, or hyper after using their inhalers, miss field trips to places that could make their asthma worse, request the removal of allergens in classrooms that trigger flare-ups, need to be excused from phys ed or other activities when they have flare-ups. Effects of asthma on schooling: difficulty completing work on time or taking part in exams, decreased academic performance, difficulty keeping up relationships with school friends, difficulty getting around the school environment, difficulty participating in some school activities, for example, physical education or exertions, feeling less confident and less motivated, also possibly affecting self-esteem and body image. What teachers can do? Students with asthma may need special consideration regarding missed instruction, assignments, and testing when they miss class time due to flare-ups, going to the school nurse's office to take medicine, and visiting their doctors. Keep in mind that students with asthma can participate in school sports, phys ed, and other activities. Students who have exercise-induced asthma may need to use their inhalers before participating in physical activities. They might have to take other precautions to avoid flare-ups. Check with your students' parents. Make sure your students with asthma have written instructions from their doctor called an asthma action plan, which tells them how to prevent and manage flare-ups. You should know your students' asthma triggers and let them use their medicine when needed. If a student's symptoms get worse after taking medicine, call the school nurse or the emergency hotline. Supporting students with chronic illness. The family and the school need to work together to establish and maintain good communication and cooperation. Everyone needs to understand what is needed and expected to support your child. The family and the school also need to be clear about what can and cannot be done so that everyone's expectations are achievable and realistic. The important things to remember are that you share information, develop a care plan, keep up good communication, make changes where necessary, and seek extra support. Regular communication between the school and the family is the best way to monitor how your child is coping at school and at home, such as academically, socially, physically, and emotionally. Making changes for students with chronic illness, extra funding support for students, and special services for students with this illness. A variety of specialist staff may be available or may be called in to assist your child. These include visiting teachers, education support officers, psychologists, guidance officers, speech pathologists, social workers, and other allied health professionals. Talk to your principal about whether any of these services may be available. The physical environment may need to be modified to allow full access to school facilities and activities for children with chronic illness. For example, ramps, rails, adaptive equipment, or disabled toilets may be needed. The academic environment may also need some changes. For example, adapting the curriculum, work requirements, timetable, or subject choices might be necessary for your child. For VCE students, you should work out whether the school will need to apply for special provision on behalf of your child. So at this moment, let us proceed to the next chronic illness, which is diabetes. Diabetes is a chronic or long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Diabetes can affect a child's learning because it can cause difficulties with attention, memory, processing speed, and perceptual skills if it's not managed. It's really important that the child is supported at school so they can manage their diabetes and get the most out of being at school. Having too much or too little sugar in the blood makes a person feel sick. Blood sugars can be checked with a blood glucose monitoring system. People with diabetes must check their blood sugar levels regularly throughout the day. Diabetes can be managed through medicine, diet, and exercise. There are two types of diabetes. Type 1. The pancreas doesn't make enough insulin. Kids and teens who have type 1 diabetes must take insulin as part of their treatment. Insulin is the only medicine that can control their blood sugar levels. Type 2. The pancreas makes insulin, but the body cannot respond to it properly. This is called insulin resistance. Most people who develop type 2 diabetes are overweight, since extra body fat causes insulin resistance. Most people with type 2 diabetes do not need to take insulin, but may take a pill to help control blood sugar. Students with diabetes may need to go to the school nurse and monitor blood pressure levels several times a day. Need to take insulin or wear an insulin pump. Need to drink from a water bottle in class and use the bathroom frequently. Need to eat lunch and snacks at a certain time and eat snacks in class. Have symptoms of high or low blood sugar. Low blood sugar symptoms include hunger, shakiness, dizziness, headache, and irritability and confusion. High blood sugar symptoms include thirst, frequent urination, nausea or vomiting, rapid breathing, fruity breath, and confusion. Students with diabetes may miss class time or be absent due to doctor visits and hospital stays. Your students with diabetes may need special consideration regarding missed instruction, assignments, and testings. People with diabetes can exercise and play sports at the same time level as anyone else. Regular exercise is an important part of diabetes management. You may want to remind students to check their blood sugar levels before, during, and after exercise and to keep a snack handy.